forceps, and levators and prolapse. So this was a case control study looking at 151 cases and 134 controls, and the cases had prolapse at least 1 centimeter below the hymen, and the groups were matched for age and race. Click. Everybody underwent full urodynamic testing. Click. And when we looked at major levator ani defects in the patients that didn't have prolapse, about 15% of them had a major levator ani defect. And when we looked at women who had prolapse, 55% had a major levator ani defect. Click. That's an odds ratio of 7.3. Next slide. In Michigan, they also looked at 80 primiparous stress incontinent women with 80 primiparous continent women. Click. Followed them up at 9 months after delivery. And here's what they saw. Here's a nulliparous patient. Go ahead and click. This is an MRI. Pubic symphysis, click. Urethra, click. Vagina. There's her pubococcygeus muscles. Let's look at the primiparous woman after forceps. Click. Urethra, vagina, and there's no muscles. Next slide. We see this on endoanal ultrasound too. Go ahead and click. Here's intact levator ani. Click again. And there's a levator ani that's going off to the side. So it's no longer attached to the pubic symphysis. Next slide. So at their MRI 9 months after delivery, 1 in 10 women had a major levator defect. 90% involved the pubococcygeal portion. Go ahead, click. And twice as many levator defects were in the stress incontinent group as the controls. So now we've tied together levator ani defects, not only with prolapse, but also with urinary incontinence. And we're also going to talk about fecal incontinence some more. Next slide. Next slide. This is a more recent article basically confirming what was found in the Michigan study, that for women aged younger than 50 years, forceps delivery was associated with significant long-term risk of stress incontinence compared to other vaginal deliveries. Next. Oh, sorry, go back one. So what are obstetric risk factors for levator defects? Next slide. Well, this was a study looking at women who had a defect, no defect, and then risk factors for having that defect on MRI. And you can see here that women who had a levator ani defect were much more likely to have sustained oasis. You can click, Michelle. They were much more likely to have had a forceps delivery and an episiotomy. Next. So the obstetricians, there is a counterpoint to every point in an argument. And there was a study that came out of Johns Hopkins and Yale looking, and I think Brown also, this retrospective cohort study looking at all births in New York City from 1995 to 2003. You can click, Michelle. These were all nulliparas, and they were basically looking at neonatal morbidity. Next. Next slide. So you can see here that over the course of the study period, essentially cesarean deliveries went up a little bit. Forceps deliveries went down, which is the trend across the entire country, with the exception, I think, of Northwestern and a few other institutions. And vacuum deliveries kind of stayed about the same, maybe went up a little bit. But this was a really large patient population, 15,000, 12.8% with forceps, 18,000 with vacuum, and 87,000 with cesarean delivery only. Next. And this is the stuff that they wanted to look at. They wanted to see where these neonatal complications, what form of delivery was associated with this, and how could we prevent this from happening? Next slide. So here's the neonatal neurologic outcomes that they were looking at, right? Because what we always talk about at Northwestern, I think, is, we want to avoid that catastrophic neonatal event with a vacuum, which in everybody's in everybody's way of thinking is that brain bleed. So this actually looked at this, right? So they looked at cephalohematoma, scalp laceration, skeletal fracture, facial nerve palsy, brachial plexus injury, subdural hemorrhage, seizures, APGAR scores, and then like a composite neurologic complication. So I'm going to highlight, and Michelle's going to click for me. So forceps for the win when you're looking at cephalohematoma or scalp laceration, right? Like definitely less likely to happen when compared to vacuum, but you know what? It's even less with C-section. Go ahead and click. Skeletal fracture, C-section for sure wins, right? Not surprising. You're not going to break a baby's skull usually in a cesarean delivery. Click. Facial nerve palsy, vacuum wins, right? We all know that. The forceps can cause facial nerve palsy. Vacuums don't. But you know what? Click again. C-section actually is even better than vacuum when it comes to not having a brachial plexus. I'm sorry, not having a facial nerve palsy. What about brachial plexus? Go ahead and click. C-section wins for that for sure, right? You're not going through the birth canal. Subdural hemorrhage. C-section for sure. Seizures. Go ahead and click. Forceps wins for that. Go ahead and click. But C-section wins over both. Next. 5-minute APGAR scores. Forceps are pretty good for that. But you know what? C-section's even better. Neurologic complications as a composite. Forceps for the win. Go ahead and click again. But C-section wins out over both.